So what do I do if I think a patient has benign paroxysmal positional vertigo, but when I test them, I didn't see it? That happens fairly often. And oftentimes the patient even believes they still have the problem, but when you test them, you don't see it, and that leads to usually frustration because they think, how in the world could this be gone? So there are a few possibilities when this occurs. First, what I do is when I'm doing the tests, I always make sure if the patient says, I'm dizzy, but I don't see any sign of nystagmus when I'm doing the Dix-Hallpike or the roll test, I often say, now, are you sure you're dizzy, or do you feel like you could become dizzy? Or some patients say, I'm spinning, and I say, now, did you actually spin, or did you feel like you could spin? So that helps to kind of figure out where they're at in their stage of the problem. But if they don't get the problem, and I really believe they have it, I'll have them sit back up, we'll rest for about 10 minutes, we'll do the tests again then, we'll do it maybe faster, I'll make sure I have them positioned properly where their heads are in the proper, most proper position, and then sometimes I'll just have them lay down, or I'll say, okay, I want you to try to make it happen. But don't be alarmed if you think they have it and you don't see it during your exam. The last thing I do is I call it go fishing. Sometimes I'll actually have the patient extend the exam over a period of time in their homes. As long as I believe they're safe, that they're not going to get sick, then I'll teach them how to test themselves for the problem. Sometimes I even teach them the treatment if I feel like I can pretty much predict where the problem is at and that they're safe to do so.